Gallstones are quite common in the general population. About 10 to 15% of the patients or people in the community will have gallstones. But fortunately, only a minority will end up having symptoms from the gallstones. Now, if you don't have any symptoms arising from the gallstones, you don't need an operation. You only need interventions for your gallstones, either an operation or anything else, only if you have had symptoms or complications from your gallstones. So not always, only if you are symptomatic. Gallstones are quite common in the population, and most of the time we don't find a specific reason for someone to have gallstones. But of course, there are very well recognized risk factors for someone to develop stones in their gallbladders. The higher the BMI, higher the chance of someone having gallstones. Now, if someone tries to lose weight, that of course can predispose for that person to have gallstones. Anyone above the age of 40 years is at risk of gallstones. Women in particular, after having babies, after having children, are at a higher risk compared to men. And of course, certain blood disorders, like, for instance, any hemolytic conditions, also can predispose someone to develop stones in their gallbladders. The typical gallstone pain is a pain in the right upper quadrant of your tummy, or in the center upper quadrant of someone's tummy. And that most of the time comes after a heavy fatty meal. And these episodes of pain can come in waves. And they occur most of the time during early hours in the morning or during nighttime. This can be associated with nausea and vomiting. And these can come as recurrent attacks where you have episodes of pain, and then in between you can be fine, and then to have another episode later on. The commonest complication of having stones in your gallbladder is what is called cholecystitis. It is essentially a situation where your gallbladder goes angry, and we call it inflammation. And when it is angry, you might end up having more pain and tenderness in the right upper quadrant of your tummy. Then, of course, if a stone in the gallbladder drops into your bile ducts and block it, you can end up in what is called obstructive jaundice. Your eyes and your skin can go yellow with this. And if the bile get then infected, we call it cholangitis. And here is a situation where you have very high fever, which sometimes with chills and rigors, and your skin goes yellow and your eyes goes yellow. Very rarely, sometimes a stone that is passing through the bile ducts can block your pancreatic duct, and the pancreas itself can go angry, and we call it pancreatitis. And sometimes one of these stones, while passing through the bowel, can cause a blockage of the bowel. We call it gallstone ileus. These are the typical complications of someone having gallstones. The typical investigation for gallstones is an ultrasound scan. It's a very simple investigation. It doesn't involve any radiation. It's just a jelly scan of your tummy, which will confirm whether you got stones in your gallbladder, and also it will give us details about how your bile ducts are doing as well. We always complement this with inflammatory markers like your full blood count and the C-reactive protein to see whether there is any inflammation, and also the liver functions to see your bilirubin level to see whether there is any obstruction of your bile passage. Now, if there's any suggestion of a stone in the bile ducts, of course, then a special MRI scan called MRCP, or magnetic resonance cholangiopancreatography, is performed in that event. But it's typically just a jelly scan. If the stones are asymptomatic, or if they're incidentally detected, of course, they don't need any intervention by way of an operation or otherwise. But of course, if you have had symptoms from your gallstones, or if you have already suffered a complication from your gallstones, then of course an intervention by way of an operative removal of the gallbladder is indicated to avoid complication. And the simple reason is that some of these complications, like for instance pancreatitis or obstructive jaundice or cholangitis, can be very serious, and we don't want to have that. And we would, as such, recommend a gallbladder removal for those patients. Yeah.